How to treat NSAID ulcers effectively? Imagine taking a medication that directly targets the root of stomach ulcers caused by certain pain relievers. That's what proton pump inhibitors do when it comes to ulcers from non-steroidal anti-inflammatory drugs. These drugs, often used for pain or inflammation, can weaken the stomach's natural defenses by blocking prostaglandin production. Prostaglandins help protect the stomach lining from acid damage. When their production drops, the stomach's lining becomes more vulnerable, and ulcers can form. Proton pump inhibitors work by blocking the final step in stomach acid production. They inhibit the proton pump in the cells lining the stomach, which is responsible for secreting acid. By doing this, they dramatically reduce the amount of acid in the stomach. This reduction is crucial because excess acid can worsen ulcers and slow healing. When taken daily, usually for about 5 days, NSAID can lower stomach acid production by around 65%. This means less acid to irritate the ulcer and more opportunity for healing. Compared to older medications like H2 receptor antagonists, NSAID are more potent and longer-lasting. H2 blockers only block one pathway of acid production and can lose effectiveness over time. NSAID, on the other hand, provide consistent acid suppression without losing their effect, even with continued use. This makes them especially useful for patients who need to keep taking NSAIDs for ongoing conditions like arthritis or chronic pain. Research shows that NSAID are highly effective in healing NSAID-related ulcers, even when patients need to continue using NSAIDs. They heal ulcers faster and more reliably than H2 blockers. In fact, studies indicate that NSAID can heal ulcers that resist other treatments, making them the preferred choice for complicated cases. They also help prevent new ulcers from forming in patients who must keep taking NSAIDs, reducing the risk of bleeding and other complications. When used alongside antibiotics to treat Helicobacter pylori infections, which are another common cause of ulcers, NSAIDs significantly lower the chance of ulcer recurrence. This combined approach can reduce the risk of ulcers returning after a year to less than 10%. This highlights how effective NSAIDs are not just for healing but also for prevention. For people who need long-term NSAID therapy, NSAIDs offer a safe and effective way to protect the stomach lining. They are available over the counter and by prescription, with common brand names like Nexium, Prevacid, and Prilosec. Healthcare providers often recommend them for patients with frequent heartburn, stomach ulcers, or those on continuous NSAID treatment. It's important to remember that while NSAIDs are powerful, they should be used under medical supervision. They are most appropriate for those with ongoing acid-related issues or NSAID-induced ulcers. For occasional heartburn, simpler remedies like antacids or H2 blockers might suffice. Always consult a healthcare professional to determine the best treatment plan for your specific needs. Using NSAID wisely can help you continue your necessary medications while protecting your stomach health, making them a key tool in managing NSAID-related ulcers effectively.